Hello everyone, I'm Matt Pillar and I'm pleased to host today's webinar titled Healthcare IT in the Cloud, Predicting Threats, Protecting Patient Data. Today's webinar is brought to you by the fine folks at ClearDATA and Health IT Outcomes. On today's call, I'll quickly provide an overview of the necessity for data security in the healthcare and IT environment. And then we'll segue to the main attraction, which is a panel discussion with a couple of experts on the subject. In that discussion, we'll tackle specific questions about the current and looming threats to healthcare data, as well as how best to mitigate those threats. So I'm very excited to introduce you to today's panelists, but before I do, I've got a few housekeeping items to go over. First, we're planning on leaving some time at the end of the webinar for a brief live Q&A. You can submit a question at any point during the webinar, and I encourage you to do that. All you need to do is use the Ask a Question module on the left-hand side of your screen. One of the most common questions we receive is whether or not you can get a copy of the slide deck, and I want to let you know that you can do that. You can download a PDF of the slide deck directly from the webinar interface via the Resources tab. However, most of the valuable data that we're going to share today isn't summarized on that slide deck. It will come as a result of our live panel discussion. Fortunately, a recording of the discussion will also be available on demand shortly after the conclusion of the call, and you can access that using the same URL that you used to register for the event. Also, if you have any technical issues with the webinar interface, simply use the Ask a Question module to request assistance, and we'll be sure to help you out. So with those details out of the way, let me quickly set the stage for today's conversation. Evolving criminal threats to healthcare data networks continue to plant seeds of fear and uncertainty in the minds of healthcare IT professionals. And those fears are well-founded. A recent Information Week survey found that 91% of small healthcare practices in North America say they've suffered a data breach. Equally disturbing is the finding that 70% of respondents aren't confident that their budget meets risk management, compliance, and governance requirements. The Ponemons Institute's third annual benchmark study of patient privacy and data security found that 6 out of 10 healthcare organizations' security systems aren't mature enough to detect or react to data breaches. Those figures don't present healthcare providers with very good odds of avoiding a breach, and breaches don't often come without significant cost. If state and federal investigations conclude that the organization has in fact violated the laws governing protected health information, the provider must deal with corrective action plans, formal resolutions, or both. That Information Week study reported that 80% of federal investigations end up generating some type of corrective action plan. And corrective action plans and formal resolutions can run well into the millions of dollars. According to that Information Week study, the average cost is around $7 million. But data breaches are rarely a one-off deal. According to the aforementioned Ponemon report, 94% of respondents had at least one data breach in the last 2 years, and nearly half of the respondents have experienced more than 5 data breaches. It's healthcare's own epidemic to cure. Now, before I introduce our panelists and kick off the discussion on the continuing threats that we face, as well as how to mitigate them, I'd like to invite your participation. We're going to take a poll to determine our audience's plans to deploy a cloud initiative. So we're asking, are you planning an upcoming cloud initiative? And the options that we're giving you to respond, and you can go ahead and click on those options now as they apply to you, are yes in 1 to 3 months, yes in 4 to 7 months, yes in 7 to 12 months, or no, just researching. So go ahead and make a selection at this point right now. We'll be more than likely referring to these results, the results of this poll here, as we work through our discussion today. So if you would just go ahead and make your selection there, we'll give you a minute to do that. All right, it looks like we've got About 60% of our attendees have responded so far. I'll give you another couple minutes to do that. All right, well, thank you for participating in that poll. We're going to go ahead and move on and click to our poll results so that you can see them here. And as you can see, it looks like about close to 66% of you are just researching, and those of you who are planning an upcoming cloud initiative are looking to do so in relative short order, between 1 and 7 months. So again, we'll refer back to this poll as we talk through today's conversation. But for now, I'd like to go ahead and introduce our panelists. And our first panelist is Chris Bowen. Chris Bowen is founder and chief privacy and security officer of ClearDATA. ClearDATA is the nation's fastest growing healthcare cloud computing company. More than 320,000 healthcare professionals rely on ClearDATA's purpose-built, HIPAA-compliant cloud computing health data platform and infrastructure to store, manage, protect, and share their patient data and critical applications. Chris is responsible for compliance and security oversight of all PHI located in the ClearDATA cloud. He's a certified information privacy professional and a certified information privacy technologist from the International Association of Privacy Professionals. And he's a certified information systems security professional from ISC2. As one of the leading experts on patient privacy and PHI security, Chris has authored dozens of articles and is a frequent speaker at healthcare industry events. Additionally, he provides consulting services to a wide array of healthcare organizations and the technology vendors that support them. Chris, welcome, and thanks for joining us.
Thanks, Matt.
Our second panelist is Mark Caderich. Mark is a 30-year information security veteran with deep expertise in specializing architecture-level design, solution design, policy generation, endpoint security, and risk management. Mark is high energy. He serves as Chief Information Security Officer for both San Diego Health Connect and North County Health Services. In other words, he's the CISO for 2 health organizations. And he's also found the time to write a book. Mark is author of Endpoint Security, a comprehensive, proven approach to securing all your network endpoints. Mark, welcome, and thank you for joining us.
Oh, well, thanks for having me on.
Okay, so first question I'd like to pose to you, Mark, and it sort of addresses the elephant in the room kind of from the start. So there remains this persistent perception that the cloud is an unproven means as a secure facilitator of healthcare data. Mark, tell us, where is that fear rooted?
Well, my belief is that fear is just rooted in the past. I often talk to my customers about cloud security versus their own security and ask them, from your perspective, which do you think is more secure? How often do you get those dedicated security reports from your team? How often do you have to deal with issues internally? And do you have a dedicated group of individuals just going out there to address the security issues associated with your systems? Most of my customers don't. So having them understand where they are on that path is my very first objective, helping them understand that having people whose job it is just to address those issues in a cloud infrastructure means that they're going to be that much further ahead of the power curve.
Right, right. Chris, did you have any thoughts you wanted to add on to that in terms of the this perception that the cloud is unproven? I mean, it's a relatively new infrastructure. Does that kind of play into it as well?
Well, I think Mark was right on. I think everybody seems to think that their own stuff is, because it's in their own location, maybe they have more control over it, when exactly the opposite might be true. I think that the perception of the cloud's insecurity is unfounded because cloud service providers, they really have to make security scale, and Mark kind of hit on this with a dedicated security staff. This really means that a cloud provider has to invest in security strategies, security operations and audit functions, certifications, repeatable processes. These things have to be measured and monitored, improved over time. And that's why what Mark said was important as it came to, do you have your metrics? Do you have your reports? How much visibility do you have? So from that perspective, I think he's absolutely right on.
Yeah.
And I'd like to add one other thing. I think the notion that the cloud is new, I think needs to be dispelled. I mean, the term cloud is fairly new, but the fact that these services have existed in one form or another online has been a pure fact of what the internet is. And I think given that timeline and understanding how well they've looked at the threats and dealt with the issues, I think there's an inherent pedigree in here that when we say the cloud is new, that we're really giving short shrift in the discussion. So there's a huge amount of pedigree built into some of this stuff that I think has been overlooked.
Yeah, okay. All right, thanks, Mark. Thanks, Chris. Okay, let's kind of transition, and obviously we'll talk about these security issues in the context of cloud. But sort of the promise made in the webinar here is that we're going to talk about some of the looming and future threats to healthcare data in general, regardless of your IT infrastructure. So, Mark, let me throw that question out at you. What specific existing threats should providers be aware of?
Well, first off, there's a large number of fairly well-organized operations out there that are dedicated to breaking into whatever your information store is. It used to be when we were starting, it was the perception that it was a hacker sitting in his basement drinking Jolt Cola and smoking cigarettes. Well, those guys have grown up and they've gotten married and they have kids and they have tuitions and they have people that they work for now, and they're very well organized. Those advanced persistent threats, if you will, are real, and people need to address the fact that this is going to be a situation that we're going to have to deal with for the rest of our lives, or until such time that information security becomes unbreakable. I'm not planning on retiring anytime soon based on that assumption, but I think that's the real issue. And one other thing I think that makes that a little bit more relevant is the fact that the people who are writing software, the very people that we're relying on to create these applications for us, need to take application security a little bit more seriously. These people are finding vulnerabilities in the code, and they're finding vulnerabilities in how the code is put together and used, and that's what they're taking advantage of. And I think software assurance is something that we probably need to take a lot more seriously than we do today.
Yeah. All right. Thanks, Mark. Now, Chris, looking forward to 2016, the remainder of this year and into 2016, what do you predict will be the top 3 security issues for the remainder?
Well, I think if you look at security as a defense in depth kind of perspective, my predictions are that people will still be the biggest part of the problem. They will give up their credentials. They will lose their laptops. They will continue to, just drop the ball, if you will. I also think that you're going to see a lot more innovations happen in security. For example, one of the drivers of having an economy of scale type of a play within healthcare using cloud is that new innovations happen at a much more rapid pace. In fact, last month, AWS, which is a ClearDATA partner, rolled out 2 new security products. This year alone, we've rolled out 7 new hardened OS templates, new network appliances, web application firewalls and APIs, and other things. So you're going to start to see integration of all of these other tools in the marketplace come to bear in a way that can really apply to your workload. So that's the cup half full, if you will. That's the good news. But I do think you're going to start to see an increase over and above the massive increases of problems healthcare has seen from the bad actors, the criminal syndicates, and the nation states as well.
Yeah, okay. And I'm sure we'll elaborate a little bit on how some of these things are executed. I mean, Mark, I'd like to ask you, and maybe we can get into some detail about what our audience should be looking for in terms of how these threats conducted by these bad actors are typically executed. Any thoughts on that, Mark?
Well, I'd like to go back and comment a little bit on what Chris said. You asked me before what I thought the big issues were, but almost right along with that is the issue associated with that social threat, the users themselves. And I think we spend so much time focusing on the technical issues as technologists that we neglect the social issues associated with exchanging data. And that is, in my opinion, almost as big as the technical threat that we're having to deal with. So Mark, just
to jump in there and clarify, when you say that the social issues, you're almost implying that a lot of this isn't even necessarily malicious, right? It doesn't begin with malicious intent.
No, I would say that right now, easily over 50% of the disclosures that we've had to deal with in my healthcare customers have been accidental, okay? Mm-hmm. Where they did something that they thought was right, or something happened to them that was outside of their control, like a laptop got swapped in the security line at the airport. Okay, I mean, how do you deal with that except to make sure that the laptop is password protected and that the disk is encrypted? I mean, you're at the mercy of our vaunted TSA at that point. So, yeah, and I think that's a training issue. Yeah, I hear laughing. It's like, yeah, TSA, yeah, funny. So, I think
you're absolutely right on that, though. Absolutely.
I think the top three security issues for the remainder of 2015 and 2016, at least from my perspective, is going to be dealing with compliance-oriented demonstrations where I have an audit, I have to demonstrate that I have achieved some level of compliance. And I think secondarily to that would be closing the loop on my detection and incident response processes, making sure that my customers understand that, yes, we will have to deal with incidents. It's a matter of how fast we can detect and respond to them. Mm-hmm. And I think the third issue that we're going to have to deal with, and that second issue is one that when we talk about interfacing with your cloud vendors, that's one that I really hammer on. And thankfully, the cloud vendors seem to understand that that's an issue, and they're very happy to help us solve it. So the third one's going to be attacking that other major component of it, which is the training, helping people understand that when somebody sends you an email saying that they're from AT&T and you need to reset your password, it's probably not AT&T.
Right. Yep. And that's a good lead-in into the...
We could go into more depth. I mean, I'm sorry. There's one other thing that I would like to talk about as an issue that's on that list is how we interface with the authentication and authorization mechanisms. That's going mm-hmm. to be a huge component of how this solution works, out in the cloud.
Yeah, okay. All right, and I think we can dive into that a little bit later here. But when we think about the threats that do begin with some sort of malicious intent, Mark, whether it's that guy that you referenced earlier smoking cigarettes and drinking Jolt in his basement, or or the the phishing scheme that you referenced. How do you see the threats that do begin with malicious intent typically being executed, and what are sort of the flags and warning signs that our audience should be looking for?
Well, these threats are typically what I call low-frequency threats, where they test your network just below the threshold of notification. Perhaps you're looking at user ID and password checks that are coming in just below whatever your threshold is for locking somebody out. That's a big one. The other thing that I think people need to think about is, what kind of research is going on the internet that is relevant to their organization. Is somebody out there trying to gather information about you and your people in an effort to understand how passwords are put together or who's got access to specific information? From a network perspective, there's also, looking at people who are doing scans specific to certain ports that, may not show up in any IDS-based detection mechanism because they're 0 days. Somebody should be looking through your, we used to call it residue. After all of your alerts and logs are parsed out and everybody understands, you're left with a high degree and a high number of log messages that don't seem to do anything. Are any of these looking at specific ports or specific groups of ports that might be associated with applications that have unknown vulnerabilities in them? And the only way to do that, to get that kind of information, quite frankly, is to have a specialized group of people that are out there analyzing your stuff. Most of the security people I know and the groups I have now are busy doing the things that we like to call the stuff you have to do to keep from getting fired. So, the rest of that falls into other duties as time permits.
Right. Yeah. Yeah. So, Chris, Mark got into some of the network and IS weaknesses that bad actors exploit. Do you have anything to add to that conversation, Chris, around thinking in terms of the infrastructure? What are they after?
Yeah, and I want to take it up a few thousand feet, and not to be a Debbie Downer, but CSO magazine had a few stats that I thought were somewhat relevant to this kind of a discussion. But really, healthcare, according to them, the healthcare industry sees 340% more security incidents and attacks than others. To Mark's point about everybody's got to deal with incidents. Healthcare is 400% more likely to be hit by advanced malware. Anthem, Premera, CHS, they suffered these kinds of attacks as well. And granted, there was a social element to those, but they were sophisticated nonetheless. Healthcare is 450% more likely to hit by CryptoWall, which is really just ransomware Trojan horse. It's when they encrypt your data and then hold it for ransom. So, Tennessee Orthopedic Alliance went through that, and I'm sure that was no fun, and many, many others go through that on a regular basis, and it's a real problem. Healthcare is 74% more likely to get phishing emails. So as Mark very aptly pointed out, AT&T may not actually be sending emails to have you click on a link to change their password. In fact, they probably won't be. But, again, Premera, Anthem, Excelis, they suffered those kinds of things as well. And one of the things that going back to the people element, is training these people to understand that how to recognize these kinds of phishing attacks. So, beyond that, we still see criminal attacks leading the cause, and employee negligence is close behind. But at the defense and layer perspective, from a network perspective, we see a lot of firewalls not configured properly with our clients before they move to the cloud. The logs are not kept. The rules are out of date. Mark hit on this really well a few minutes ago, which is application security and coding practices. We run a fair amount of those services for our clients, and we see passwords hard-coded sometimes with our clients. We see input forms aren't validating against SQL injection. Even just basic SSL security is missed when you're lighting up the application. So cloud providers can help guide our customers in that way. And then not even counting the data layer, encryption should always be encrypted on laptops and others. Backups should be restored and tested for the backups and such. But by and large, we're also seeing security lacks attention at the server level. Ineffective access controls, lack of patching. A lot of times, Mark will probably laugh at this, but people putting PHI on a web application server instead of in a secure zone. Hardening standards are just ignored as well. So I do have some perspective on that. And I hear you laughing, Mark, so it sounds like you've seen that once or twice.
Well, as a matter of fact, I saw it as recently as last week. In all fairness, you hit on something that's hugely a problem, which is the fact that the very workflows that these organizations rely on and the applications that support the workflows are the ones that they are absolutely loath to change. So what we're looking at here is organizations who have spent years developing their clinical workflows, and now we're stepping in and saying, hey, we're asking you to transition to this new methodology, this new type of technology. And they have all of these issues built into their existing infrastructure still, because the software and the processes and everything that they've been doing are, they're designed to help them deal with their patient loads. And when they see something that comes in that purports to change what it is they're doing, they get a little nervous about it. So part of what we're going to have to do is we're going to have to be very sensitive to the fact that as we ask this huge group of clinicians to come into the 21st century with us, we need to make sure that the very workflows that they're dependent on are represented accurately and securely in whatever solution that we're bringing to them. So I think one of the things about cloud that I really think needs to be highlighted here is the fact that it can very easily adapt to those changing workflows, whereas the applications that are built into the infrastructure now, we can't even update them fast enough to deal with the changing threat landscape. What makes us think that we're going to be able to deal with adapting them to changing workflows and enhancements in our clinical technology? I've got mobile technology, and I've got all kinds of other technology right now that people want to be able to use that I can't even think to integrate into the dedicated infrastructure that's in the basement of some of these hospitals.
Mm-hmm. Here.
Yeah, whining over with. I'll quit whining. Sorry.
No, I think it was great. It outlines the problem, and that's another great point, and that is, those who wander into the world of healthcare technology, if you don't know about it or know its nuances, it's a very difficult journey, and you need to understand the workflows and the integrations and the silos and how to overcome those. To Mark's point, as he really well said. Right.
Yeah. Okay. So that last exchange gave a pretty comprehensive kind of view of the landscape of threats that exist. Let's kind of shift a little bit to what data is vulnerable to that ever-changing landscape of threats. Maybe some specific data points such as PHI and Social Security numbers. What exactly, in other words, are people after?
Is that one for me or Mark?
Yeah.
Mark,
go for it, Mark.
Yeah.
Well, based on what I've seen in my environments, it is an equal opportunity environment. I think the PHI, although it's out there, I don't see that as being as huge a threat unless it's a target of opportunity. If you look at why people are doing this, they're looking at it to commit fraud and abuse and essentially steal services or money from the providers. The only way they can do that really is with PII. Social security numbers, personal information, understanding, essentially the same information that they use to steal identities and create new instances of credit. That seems to be the prevalent set of issues. The disclosure of PHI, to me, based on what I've seen, seems to be one of those issues associated with how can I blackmail somebody a la, Ashley Madison. I've got information about you that you don't want anybody to disclose. How much are you willing to pay for me not to disclose it? Not as prevalent as just theft and fraud, to be quite honest with you. This is all about the money in the end.
Right, yeah. Thank you, Ashley Madison. You can't have a conversation about data security without bringing up Ashley Madison.
I still get phone calls about that.
I'm sure you do. All right. So, Mark, in your response, you sort of identified that it's an opportunist game, and the data is kind of variable depending on what that easy opportunity is. Who are the opportunists? And Chris, maybe I'll throw that question at you. Who's after the data? Who are these opportunistic bad actors, and why?
Well, there's quite a few bad actors out there. We're seeing them involve, to some degree, nation states. They're getting the most attention lately. Mark was right. Medical identity thieves are going after these as opportunistic type of attacks. But a lot of times you'll see hospital workers involved in some of these criminal rings. For example, there was a case where criminals in the Montefiore Medical Center in New York, 8 people were indicted in June of this year just for stealing and using patients' PII to make purchases at department stores. So 12,000 patients were compromised because of that. And the specific case here was a 32-year-old assistant clerk in the hospital wing of the center. She had access to the dates of birth, Social Security numbers, other PII, and then she would print these records and hand them out to the ringleader for about $3 a record. And then those were passed around to others who went and collected gift cards and store credit and went to town, if you will. So we see that's probably more common in number than you'll see a deep panda trying to jump in and steal 80 million records, because this happens a lot. As to why, well, there's definitely the financial gain part. There's the espionage, theory for the nation states. Sometimes blackmail, as we've seen. Sometimes they're trying to seek treatment for a condition they can't pay for, and so they'll impersonate somebody to get prescription drugs or to defraud the government. We've seen even some just do it for bragging rights as part of the training exercises they go through with their criminal syndicates. So lots of different reasons. I'm sure that none of those are comforting to anybody, but you just have to always be diligent.
Right.
And if I may, 2 things. One, it brings up the issue of the inside job. The authentication and authorization mechanisms are absolutely useless if the very people you've entrusted access with are the ones that are stealing the information. And that can be an extremely prevalent problem depending upon how well people are paid, what kind of culture is there. I mean, somebody offers you $3 a record for 1,000 records, and all you have to do is spend 15 seconds downloading something. how hard a choice is that going to be if you've got a mortgage payment that's due and your kid has to have, their teeth aligned or something. So that brings to mind the audit issues associated with it. How well are you auditing things? What kind of instrumentation do you have? How often do you revisit the output of those devices in order to make sure that they're giving you a truthful picture about what's going on? Well, another thing I'd like to point. One more point about what Chris said, and that is, I think one of the things that is not given as much credit as it really should is the fact that I think some of these state actors are actually looking for, proprietary device information. By hacking into the network and talking to these devices, they can get the devices to talk to them in ways that give them a lead as to how they're performing, what they're doing, and perhaps at some points maybe even giving up some of the code. So I think that's a component that a lot of us really haven't thought about, is that industrial espionage aspect of it. Sorry, Chris, go ahead.
Totally agree. Totally agree with that, Mark. And I think that brings up another great point, and that is your audit logs. How often are healthcare providers not thinking about the syslog architecture required to offload logs from these servers, these devices, these ecosystems, so that if there is some kind of event that they need to investigate, they'll actually have the information that they can actually use in an investigation. So that's another huge weakness that we're seeing with on-prem type of solutions.
Yeah, just, do you even have a centralized clock? That's my first question. And when I get
exactly.
The deer in the headlight look, it's like, okay, now we need to move ahead.
So, Chris, you brought up a good segue to another question I want to ask, and I want to jump back into cloud. You talked about the on-premise solution, and I'm wondering. I mean, we've discussed, as I said, quite the landscape of threats. Are any of them, any parts of this discussion that we've had so far, specific to the cloud? I mean, are there specific threats that impact the security of healthcare data in the cloud?
Well, if you go back and look at or examine the dialogue, I would say no. I would say that criminals really don't care whether the data is on the cloud or in your office. They just want it. They want to go where it's easiest to take. So if they can, get your access controls or credentials, if you will, to your cloud-based systems, they'll go there. They'll just as easily go to your car and break your window and take it while you're at the bar on the way home. So it's not easy to break into a data center with 24-hour security guards. It's easier to hit your clinic or your office. Can they brute force attack your password and crack it? Probably, but it's a lot easier for them to trick you into giving it to them. So again, Mark said it well earlier, and that is criminals are opportunistic, and if the job can be done in an easy way, they will go the easy route. So I don't think it's specific to the cloud at all.
Yep. Yeah, and I've got to agree with that. I really have to agree with what Chris said. I think it's really more a matter of what's the easiest thing for you. Outside of opportunistic, that's just a polite way of saying lazy. They're looking for a quick buck. They're looking for a way to, turn time into money. And if the easiest way is to smash a window to steal a laptop versus, spending, 2 days trying to go through a password file, that's what they're going to do. Mm-hmm. And our job is to make it, a little harder. We need to ratchet up those protections so that they go somewhere else. In my opinion, I think as cloud becomes, the de facto standard for the best practices or level of protection and trust that we're going to see in systems, they're going to start focusing on those organizations that are keeping their applications in the basements in their own internal data centers. And I would love to see somebody do some kind of a survey and break it down into, If you have a cloud service, what does your attack profile look like? Versus if you have your own internal supported data center, what does your attack profile look like? I'm willing to bet in 2 years you'll see more and more attacks being focused on those in-house solutions versus the cloud.
Sure. Yeah. Okay.
I agree with that, and the other part of that is, let's look at your ability to keep that data available. Do you ever have a power outage? Maybe that's different in the cloud than it is on your on-prem. I bet it would be. So other kinds of factors
don't even get me
should go into that survey, Mark.
Yeah, don't even go there right now.
Pushing Mark's hot buttons this morning.
No, we are.
All right, let's transition to the solutions that we should be discussing here. And I imagine that the responses on the solutions question are going to be as wide and variable as the threat landscape. It's a big conversation. But Mark, I'll start with you. How are the threats faced by healthcare providers mitigated? And again, I fully anticipate that that's a long-winded response.
Most of my responses are long-winded. I mean, that's kind of the way I'm wired. I think being a CISO, one of the things that I see that is the most prevalent mistake is people think they can piecemeal this solution. They look at it as, okay, here's some budget, let's throw it over here. What I think they should do, and what I've been very successful with my customers in doing, is creating an architecture, an end-to-end architecture that incorporates and integrates all the various aspects of their infrastructure. So instead of looking at IT security and saying, oh, well, we just need to worry about antivirus and intrusion detection and firewalls, we start looking at how routers are configured. We start looking at how cloud vendors are selected and what kind of security provisions they have. And we look at this as a complete solution so that we can discuss it as an end-to-end closed-loop process. Once we start doing that, we start seeing the edges and the transitions, and we start seeing what the bad guys are seeing. And it helps us understand what we need to do to be prepared for it. And the other part of this is that test environment needs to have that same attitude. Instead of checking a box that says, yeah, I've got an IDS system that sends me a message, start timing how long it takes. You run a test, how long does it take for your providers to see it? How long does that notification take to get to you? How long does it take for your people to respond to it? We've been doing this with fire drills since the dawn of fire. I mean, I can imagine cavemen, they hear the alarm go off and they all run outside and somebody's out there clicking rocks together to see how long it takes. We don't even do that basic kind of testing in our environments right now. My customers are doing that. They're working with their vendors now to integrate that testing environment. But doing that helps you understand where your money is spent and how that money is being spent. And off of that comes things like authentication integration, authorization integration. How are you looking at this process? Is your vendor working with you to simplify that so that it's not another screen that somebody else has to manage? It's another transition in that whole process.
Right.
I totally agree with that, Mark. I might add also that the security risk assessment is probably part of your customer's approach. You probably do those to find out where you're weak, where you're strong, and also where the data's at. Yeah.
Absolutely. We do that. The risk assessment, part of that risk assessment is we launch that risk assessment, and that's when we start getting timing. That's when we start understanding how long some of this process takes and where the areas of the network that need a little bit more love and care. What kind of patch management are they employing? Which systems are protected? It's like the old PCI stuff. They focus on a couple of systems and forget that those other systems have trust relationships with other systems. in the environment, and they forget about those trust relationships. And that's part of what this overarching approach is to understanding, who trusts whom in this environment, and what kind of an attack vector are we going to have to deal with. And that initial assessment is part of that. And ongoing assessments help you understand how well you're doing.
Yeah, I was going to ask a follow-up question to both of you on that, regarding ongoing assessments. I mean, you talk about a risk assessment, and you talk about an attempt to have sort of a holistic, end-to-end approach. But it's a constantly changing landscape for the provider as well. I mean, healthcare, as you guys know, is one of the most merger and acquisition active industries in the nation. So between mergers and acquisitions and integration and new technologies and new facilities opening, it occurs to me that there's a constant need for continuous assessment. Is that true?
Continuous.
I believe that.
Continuous.
Yeah, I believe in continuous. I'm going to jump in here and say that all of my architectures focus on the environment being a movie rather than a still photograph. And reacting to that and having systems that react to those changes are key components to my security architectures.
Yeah, and when you say continuous, you mean continuous as opposed to frequent. Is that correct?
Yeah, I believe that your architecture and your security tools need to constantly be looking at what your security profile is and what's happening. Now, some of that may be technical, some of it may be process-based. I mean, some of it may just be dealing with your configuration management environment. So like once a week you have a CM meeting and somebody asks the question, okay, what percentage of systems are new on our network, and were they part of a golden build, or are they updated? What's our patch situation? How many vulnerabilities did we address last week? How many times were we attacked? How many laptops have been stolen? This is all part of that process.
Yep. Okay.
I do have a question. We're seeing questions pop up on the chat here. Are we going to address those at some point?
We are, yeah. We're going to address those very soon, Mark. Yep.
Okay.
We'll hit those in just 1 minute. We're going to start wrapping up here, and I want to just throw a final question out to both of you before we get into the audience Q&A. And we've talked about a lot of advice here, but if you could each kind of comment on the single best piece of security advice that you have for healthcare IT professionals, regardless of their network infrastructures, what would that be?
My thought is that security really needs to be done in depth. There's really not a silver bullet that will solve your security problems, nor is there a single architecture. It has to be done at the 5 to 7 layers of defense that you're going to address: network, application, server, OS, device, data, policies, procedures. It's really a battle every day. This is my other piece of advice. It's once you think you've won, you've lost. So you need to keep at it, and don't be afraid to feel like you're the town crier in raising the flag if you think there's an issue. And then finally, really, Mark has said it in his previous comments as well, but understanding what a good partner can do for you to be a key to your success is really important, and choosing the right group of folks to help you is critical.
Yep. Mark, what are your...
I'm assuming the ball has ponged to my side of the table here. I have one question that I ask folks, and it's a very simple question. What is your security architecture, and why do you believe that it's working? And by simply asking that one question and getting people to answer it, the rest of the obvious questions wind up being asked. Having people understand what it is they're doing and why they're doing it, and getting them to admit that they have some coverage issues is the very first step in getting them to begin fixing it. And having partners that are very good at what they do is absolutely critical in solving that problem. Most organizations I deal with are so wrapped up in dealing with their day-to-day issues that they can't take the time to take a step back and answer that question. They're so busy dealing with the day-to-day failures of all of this technology, care phones that don't want to work, or imaging systems that refuse to upload images, or any number of day-to-day issues that force them into a place where they can't worry about anything further out than 48 or 72 hours. But this is critical. We need to get a better understanding of what those security architectures are and why we even believe that they're functional, much less being able to rely on them to tell us when bad things are happening.
Good. Okay. All right. You guys ready for some audience questions?
Oh, yeah.
Good. All right. Let's do that. We've got a question here.
I think the first 4 should go to Chris, too.
From Sam, looks like.
We'll let you arm wrestle over them. So here's a question. What are the relevant compliance and conformance tests to ensure one's network and systems are as secure as possible? And there's a follow-on to that. What agencies contest that compliance and/or ensure conformance with appropriate industry, international, federal standards for data at rest?
Well, that's a small question. That is a very broad one. I think it depends on your system. It depends on what you're trying to test. If you're trying to test your cloud solution, there's some great tools that you can use to test that. Qualys makes a great tool, Rapid7. Again, going back to our economies of scale discussion, a cloud provider can invest in the expensive enterprise-grade tools, whereas an on-prem solution may struggle with some budget concerns around that. In terms of agencies testing, we're a fan of using best-in-breed third parties, folks like reputable penetration testing firms, reputable vulnerability management firms, and reputable security assessment firms. But I'm sure Mark has some great thoughts on this one as well.
I do, and I read the question a little differently, but I have a huge reliance on people's compliance with some of the government standards. NIST is a great place to stop for some of the basic issues regarding cryptographic security and cryptographic implementation, and our industry focuses a great deal on that. There's a number of other government agencies that have some templates for assessing security. I wouldn't rely 100% on the government for that kind of stuff because they're the people who brought us our government. But some of these agencies do have some really, really smart people out there that are capable of helping us understand where some of our weaknesses are. There is no one place that we can go to say, hey, this is the agency you can go to like Health and Human Services, will you test my network? No, that's, as Chris pointed out, we have to rely on professional groups to do that. But in our design process, we can always reference the relevant standards that NIST has brought to the table. And as far as software assurance, our friends at DHS have actually come up with a fairly decent way to, DHS. If I had heard myself say this 10 years ago, I would probably be laughing hysterically. But DHS has actually done a lot of good work in software assurance programs and understanding software assurance life cycles and networks. So those are a good place to start.
Mm-hmm. Okay. Okay, Chris, here's one for you. How much more complex is cloud security due to the explosion of devices that healthcare professionals are using these days to access cloud data?
Well, if we look at devices, there's a lot of different kinds of devices. If we're talking about mobile phones, iPads, those kinds of things, you still have an ecosystem of what makes that application run. So you still have the basic security elements around the server, around the data encryption and transit at rest. But it gets a little bit more complex as that data egresses into the device. And that's where the device maker really has to, or the software maker for the device, really has to pay attention to what they're logging, how are they storing those logs on the device, or are they storing any of those logs on the device? Could those logs be accessed and be used to compromise any data that's possibly accessed on the device? We also, going back to what Mark said about secure coding and software assurance, we also take a hardened approach to any kind of device software. So we shouldn't be storing any PHI on the device if we can help it. And if you do, how is it encrypted? So some of the basics still apply. It's just that they're applied a little differently for a specific device. If you're talking about a pacemaker, Wired did a great study about these types of devices having default passwords in the web interfaces, and so it goes back to the basic blocking and tackling, just applied a little differently.
Mm-hmm. Okay, and we've got time for, I think, one more question before we need to wrap up here. So, Chris, I think this one's for you as well. The question asker said that there was a great emphasis by you guys, you both, on continuous security risk assessment, and he's wondering what frameworks ClearDATA provides for this. So
we do about 200 or 250 or so security risk assessments for clients every year. And in that scenario, we use the typical HHS, OCR, auditable, ready type of assessment. For our own medicine, if you will, we are strong believers in the common security framework from HITRUST. HITRUST involves many other frameworks as well, including ISO and SOC 2 and COBIT and some other controls. But we also adhere to the SOC 2 protocols as well. So, and then there's the occasion where we help our customers go through those processes, whether it's HITRUST, SOC, ENAC, other types of frameworks that are required, and in some cases even FDA, GXP type of principles.
Mm-hmm. Okay, great. Well, good. That's we're moving up on the top of the hour here, so we're going to need to wrap it up at this point. I'd like to remind our audience that if you ask the question that we did not get to, we've got those logged, and either Chris or Mark will be happy to follow up with you, I'm sure, following our presentation here. But I'd like to thank Mark and Chris for providing our audience with a very lively and informative conversation today. Thanks, Mark and Chris.
Thank you.
You're welcome. Thank you for having me. It was a pleasure.
No, the pleasure was all ours. So that's going to conclude our webinar today, and I want to thank our audience for joining us. Also want to remind you that you can visit ClearDATA.com for more information and resources on healthcare data management and security in the cloud. And also be sure to visit this recording on demand using the link that you used to register for the event. We also encourage you to share it with your colleagues. Have a great afternoon. Thanks for joining us, and enjoy the rest of your week.